All right, good day, everyone. This is Carlos with Ability News, and very excited today to be joined by Jeff. Jeff is with the Jeff Staker. Jeff is with the Hoosier Veterans for Medical Cannabis. Jeff is a former Marine, also served on the police department as well as a current firefighter. And Jeff has started a nonprofit organization called Hoosier Veterans for Medical Cannabis. Jeff has been accomplished a lot in the state of Indiana in terms of legislatively. Also played a very significant role in Indiana's current legalization efforts in regards to CBD oil. So Jeff, welcome. How are you?
Just fine. Thank you for having me on your show.
Absolutely, absolutely. Thank you. Well, I know that there's a lot going on right now, both locally and nationally, in regards to Hoosier Veterans for Medical Cannabis in terms of cannabis legalization. And we had talked the other day regarding some very interesting things going on. So I'll just open it up to you, and if you want to talk a little bit around your organization and share, why you started it, that would be great.
Well, the reason I started it was up until July of 2016, I was on prescribed Oxycontin for chronic pain. And I was getting that through the VA, and I was running out of my prescriptions early and talking with my doctor at the VA, and he recommended that we probably discontinue that because I could run the risk of overdosing. And I inquired as to about all the states passing medical cannabis, what he thought, and he said if he could prescribe it or recommend it, he would. And that's what got me going. It should be an option for Hoosiers here in our state as a medicine, in lieu of all the opiates that were being prescribed. And that's what got me going.
And that's great. And if you take a look at the different benefits of use of cannabis, Jeff, when we had met earlier, we had talked about the importance of what cannabis could do, in particular for our veterans, our veterans, and you had shared with me some very eye-opening statistics in regards to veterans regarding the suicide and everything. Can you touch base on that briefly as well, please?
Well, you know, being a federal employee right now, one thing that's probably unusual about me is that I don't consume cannabis because, for that simple fact, through the occupation, we get urinalysis tests, and it's still a Scheduled One drug. However, the statistics that I've researched, and this has opened my eyes that we're losing more veterans each year to prescription overdoses and suicides than all the combat deaths we've had since 9/11, and we're losing those on an annual basis, over 17,500. And it's heartbreaking to think that statistically, our young troops going off into combat have a better survival rate than if they come back and have that same government treat them of their wounds. Um, it's just phenomenal. So obviously, we've seen in states that have medical cannabis laws, we've seen a reduction in the overdose rates, and we've seen a reduction in the suicide rates. So, it's unfortunate that our state legislators do not look at those statistics and try to implement them here. Unfortunately, what they've done is just the opposite. They have tried to piggyback on top of the Comprehensive Addiction Recovery Act that Congress passed last year, and they're just trying to reduce how opiates or cut off how opiates are being prescribed to citizens. But unfortunately, for those people that have been on it for quite a long time, they're already addicted. And when you cut them off or cut them back, if they, have no beneficial alternative, they're going to turn statistically to a harder drug like heroin or something to that effect. And some of the veterans are doing that unless they can get or have the opportunity to have medical cannabis as part of their treatment. So I was just fortunate. I did not have the withdrawals that a lot of people get. Obviously, there are times when I do need the medication, but I just got to push myself through it and try not to strain myself with the chronic pains that I have from time to time. So.
Right, and that's why your work is so important, Jeff. Our service members, our service members that have overseas served in combat, to think that, you know, unfortunately, significant come back with post-traumatic stress disorder, and they end up on these opioids, and that we can do better for them. And then to hear the suicide rate among our vets, we as a society, we as a country need to do better to take care of our vet. And that's why I think in part, your message and your passion resonates so well within the community. And I know not only here in Indiana, but nationally, you've been doing some tremendous work. And I know that you have in part, uh, worked brought together a forum to take a look at nationally. And real quick, speaking of cannabis nationally in terms of medical cannabis, there's recent statistics that have came out that the majority of Americans support legalization efforts for medicinal cannabis by an overwhelming, I think at least 88%, something very high, something very significant. So for our legislators who are supposed to represent the people not to understand that and really work with the community to understand that these laws should be passed, it's very heartbreaking. But again, turning the attention back to your efforts nationally, would you like to share a little bit about your current efforts regarding
Sure.
medical legalization,
Well,
please?
sure. Let me go back to the statistic. Well, let's look at Indiana. You know, 73% of our citizens are supportive of medical cannabis in our state. And the polls from the American Legion, the Indiana American Legion, shows about 86, 87% of our veterans are supportive of medical cannabis. And yes, obviously that representation needs to be within the state house, and it is not. So at a national level, yes, what I've done is back in May, I was asked to attend, it was called a Patients Out of Time conference in California. And it was really a who's of doctors and professors, researchers, attorneys, and they asked me to speak. And I was just really overwhelmed with the knowledge and information that was out there.
Sure.
And so what got me going is the Secretary of Veterans Affairs, Dr. Shulkin, has stressed a couple times, especially at a White House press briefing. They were asked about he thought about medical cannabis for our veterans, and he says, "Well, this is something that we need to look into." And unfortunately, it's still a Schedule I, and federal law prohibits the same stuff. And then a couple days later, he did another interview. Basically was asked the same question, and he gave the same answer. We need to look into it. So I inquired to the powers to be at the VA, at the higher up, and sent out some messages. And he kept putting his foot in the door, and I said, "Well, we can open it. So we can open him and show him exactly what medical cannabis can look like for our veterans." So about 3 to 4 weeks ago, I get a call from a senior White House advisor named Jake Leinenkugel, and he's the senior White House staff for the VA. And he said that this forum is a doable thing. And on September 13th of next month, we will have this forum. And I brought together 5 doctors throughout the United States and Canada and 5 other veterans activist groups throughout the United States doing exactly what I'm doing. And we're going to sit down with the senior VA staff. And I understand the Undersecretary of Health is going to be there, along with a bunch of federal legislators from both the House and Senate side. There is a congressional cannabis caucus, and we're going to have all the large, the VFW represented, the American Legion, DAV, and AMVETS, and we're going to sit down and about a 2-hour forum, and we're hoping it's going to be on C-SPAN So this could be recorded, and people can download it and take what they want from it. But it's going to be very informational. I've got doctors talking from everything from the current stats that we have about cannabis, and the doctor I've got coming down from Canada, Dr. Daryl Hudson. He was instrumental in implementing the Canadian VA's medical cannabis program. So that's going to be an interesting topic of discussion. One of the other things we're going to talk about is PTSD, and the other one is the opiate practice of the VA and how we can combat this. You know, we're not going to combat it by just giving out Narcan and having rehab for people. That doesn't work, especially when you've got people dealing with PTSD and chronic illnesses that have to be treated for a long period of time. And obviously, opiates should never be used for a chronic illness whatsoever. So we're looking forward to that. It should be pretty exciting.
That is, it's very exciting to see the attention that it's getting, nationally and with the current administration, and regarding our troops, regarding getting them the best access to medicines, healthcare. It truly should be a nonpartisan thing, Jeff, and I think that's something that we as all Americans need to remember, that politics doesn't have to become involved with this issue. This is an issue that cannabis, the research is coming forward that shows the effectiveness of cannabis to help with the opioid addiction, to help with several health causes. And so that's why your work, again, is just so important. Now, Jeff, I know that you are a nonprofit organization. I know that it takes funds to organize. It takes funds. I know that you had booklets printed that you distributed to every acting representative in the Indiana legislature. I know all those things comes as an expense. So how can the community, how can people help support Hoosier Veterans for Medical Cannabis?
Obviously, we have a website that you can go to, Hoosier Veterans for medicalcannabis.com or .org, either one. And there is a donation area there, or you can mail it to our P.O. box that's on the website there. And I'm going to be in D.C. from September 10th through the 16th, before and after this event. And I'm budgeting about $3,000 for everything involved, and that's being very conservative for the D.C. area.
Right. Sure.
And but there are people out there that I know want to help, and I'd appreciate the help. And it's only thing I ask is that people just give from the heart. I don't, I'm not out there to beg, borrow, or steal. But if people are really wanting to see this go forward and really want to be behind me and the things that we do here within the state and at a federal level, your support is more than welcome.
Absolutely, and we want to show our support. So again, in terms of the trip, that's going to be incurring, it is significant, and if we get several people involved, we know that budgeting tight with a lot of families right now, but if we get several hundreds, a couple thousands to help, donate $1, $5, and exactly what you said. I like what specifically that from the heart. And again, that's why I will be donating, because again, your work is just so important to help veterans with their health needs. So Jeff, any closing thoughts that you'd like to share with our listeners?
Well, the thing that we probably haven't talked about, some of the things that we need to start thinking about with the state. And I've sat down in the past, that all these bills, we've had 11 last year that dealt with medical cannabis in one form or another, but they've all been, for the majority of them, been presented by Democrats. So I think we really need to push the GOP here within our state to take over those bills. I've talked to Bill Friend, and on the House side to take over Sue Arrington's. I've talked to Randy Head. He's very supportive, but he doesn't seem like he'll sponsor it. So I'm in the process of setting up an interview with Senator Hirschman and see if he would take over Karen Tallion's bill. I think if we can get the GOP and we can get some hearings and we can get some influential doctors at those hearings to talk about the good, the bad, the ugly, and answer any questions that they might have. I think we can beat this epidemic that we've got in our state. And unfortunately, we've gone in the opposite direction because we last legislation they passed all these anti-opiate bills here within our state, and our overdoses have just started to increase. They haven't gone down; they've gone up. And I knew it beforehand because I've seen it with the VA. And unfortunately, the veterans are the canary in the coal mine. And, so the writing was already on the wall. And hopefully, our legislators will open up their eyes and see that the numbers aren't going to work the way that they want it to. And we need to treat this as a medicine. Obviously, I know there are states out there that have recreational use and whatnot, but if we can treat this as a medicine that it's always been for thousands of years, I think we can do this right within our state.
Absolutely, absolutely. I agree 100%. So, very exciting thing. So, uh, Jeff, also share with our listeners. Through this interview, I do have your website brought up, but how, Facebook. You're also on Facebook. I believe that there's some videos on YouTube for yourself. Are there any other ways people could contact you directly? I know you have your website with your information. I think we have about all of it, but most importantly, the thing right now is in terms of getting ready for this big roundtable, this big forum that's going to be occurring. So, if our listeners can help support that, it would greatly be appreciated.
It would. I think all the information there is my PO box and address is all there. If there's a donation spot there on the website that they can do through PayPal. Um, Obviously, you're paying PayPal a percentage, so if you want to send a check and know that 100% of your donation go to just send it to the through mail. And I think my phone number is on there too. So if you want to call and talk, I'd be glad to answer as many as I possibly can. But obviously I'm going to be very busy here within the next 4 or 5 weeks.
Absolutely. Well, we really appreciate your efforts, Jeff. So, audience, Jeff Staker, everyone with Hoosier Veterans for Medical Cannabis. This is Carlos with Ability News. We like to cover the issues that matter the most, and honor and a privilege to speak with you, Jeff. So, I want to thank you so much.
Thank you. I appreciate being on your show.
All right, take care.
Okay.